I'm Tinabeth Piña. How about getting a prescription for a dose of bee venom or leeches instead of an antibiotic? That's coming up next on Science and You. I'm Tinabeth Piña. Back in the day, doctors relied on nature to help their patients heal. Nowadays, those folk remedies are resurfacing, allowing people to turn to bugs and not drugs for treatment.
I've always thought that the bee sting was the original acupuncture needle. So it's not that big of a surprise that people are going back to some of the, quote, older remedies.
Frederic Keller, a licensed acupuncturist and apitherapist, uses all the products of a honey beehive medicinally.
So each of the products of the hive have a specific function within the hive and also medicinally for human consumption as well.
Like what?
So the raw honey would be good for desensitization of allergies. It's good for promoting sleep at night, promoting digestion. The pollen would be good for, it's pure protein, so it would be good for, as a nutritional supplement. The bee venom is obviously good for, as an anti-inflammatory, to relieve pain for various conditions.
Although there is no proven scientific evidence supporting the use of apitherapy, it can be used to help manage the symptoms of various diseases.
I would see it more as an adjunct treatment because it is so little known, especially here in the Western country, especially in the United States, that many people come to it as a last resort after they've gone through a lot of drug therapy and other therapies.
Many years ago, about 7 years ago, I was very sick with Lyme disease. I had done the antibiotics for a very long time and they were not working. They would get me to a certain point but not get me better. And I'm really glad that I came because it helped me a lot. It really took the pain away, took the inflammation away. I would rather do this and then take all sorts of medications that can have negative reactions.
Bee venom has a powerful effect on the circulatory system and stimulates the release of cortisol while facilitating the elimination of toxins and metabolic waste. It can lessen inflammation and help regain movement for arthritic patients. But before treatment, you have to get tested for allergies, since 1 to 5% of the general public is allergic to bees.
For new patients, she'll do a test sting, just to show you how it feels and just to make sure you're not going to have a bad reaction to it. The first maybe 10-15 seconds, it's a pretty strong, sharp sting, but it's not bad.
Another folk remedy handed down through the ages is Hirudo therapy, better known as leech therapy. These bloodsuckers have been around for thousands of years and were approved by the FDA in 2004 as a medical tool for skin grafts and reattachment surgery. They are also used outside of the OR as an alternative treatment for mild to moderate medical conditions.
Outside of neural medicine, we usually see leeches as parasites, but no, they're really little pharmaceutical factories.
Dennis suffered a hematoma while playing soccer and turned to leeches to bring down the inflammation and relieve the pain.
No bruising left over right now. And the swelling, it went away in a day, as opposed to if I would have been just taking any sort of home meds, say ibuprofen or acetaminophen, it would have taken weeks to achieve the same result. The leeches exchange their saliva with you, so they exchange anesthetic, which numbs all the feeling. They exchange anticoagulants, which makes the blood flow better.
The myth was that leeches, they suck out the bad blood, so-called bad blood, and they have to be big and gorge, and they have to depart from the host. And it's not true. It's the primary indication and primary benefits from the Hirudo therapy is injection of those substances, the proteins go to our body, and then oozing, the second step, from those little wounds what the leech creates, there is a post-discharge and a release of the accumulated toxins.
Leeches are only used once per treatment and are euthanized immediately. They can help relieve migraines, varicose veins, skin and gastrointestinal diseases, and can even help treat glaucoma and cataracts.
Do you literally put the leech on somebody's eyeball?
No, we don't. No, they are biologically active points when you apply the leeches, and again, they affect the smallest vessels in circulatory system and in the eye as well, and that's why you can take care of eye diseases. we do apply leeches. It's a local chirurgotherapy. When the tissue is involved, it's damaged. We're going to the essence of the chirurgotherapy. It's the blood, and the whole health and life is in our blood. Other words, when the circulatory system works and the microcirculation is restored, you get back your balance, you get back to homeostasis.
For those of you that might be a little too squeamish, there is an alternative to leech therapy. Scientists have developed a mechanical leech that can perform some of the same duties as a live leech, but without what some of you would call the gross out factor. For Science and You, I'm Tinabeth Piña.